Having your Picc line put in. This animation shows how a Picc line is put in. A Picc line is a long, thin, flexible tube which is inserted into one of the large veins of the arm, near the bend of the elbow. It's used to give intravenous fluids and medicines like chemotherapy and drugs such as antibiotics. It can also be used to take blood. Having a Picc line means you don't have to have repeated injections or needles. Once it's been put in, it can stay in for several weeks or months. It stays in until all your treatment is over. The Picc line is put in by a specialist nurse or doctor in hospital. First, the skin in the area is cleaned with antiseptic solution. Then, the area is numbed with an anaesthetic cream or injection. This is so you don't feel pain while the Picc line is being put in. When the skin is completely numb, a needle will be inserted into a large vein in your arm. This will be a vein that leads to your heart. The Picc line is threaded through the needle and into the vein. It is threaded through the vein towards the heart. The needle can then be removed, leaving the Picc line in place. This shouldn't take long and is usually painless. At the end of the Picc line, there is a needleless connector. The nurses will use this for everything they give you through your Picc line and for taking blood. The Picc line will be held securely in place by a see-through dressing. Having a Picc line put in shouldn't hurt because of the local anaesthetic, but it may be slightly uncomfortable and you may feel a bit of tugging. You will then have a chest x-ray to check that the end of the tube is in the correct position. Before you go home, the nurses will show you how to look after your Picc line. Most people don't have any serious problems with their Picc line, but problems can include a blockage or infection. To make sure the Picc line doesn't fall out by accident, it should always be covered with a dressing. If you have any questions about your Picc line,